Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. Progressive MS can have a significant impact on so many aspects of daily life, including mobility, driving, personal care, cognitive skills, and even mood. Rehabilitation is an important part of treating MS, and there are tools that can help enhance mobility while promoting safety and independence for people living with progressive MS. Doctors Deborah Backus and Brad Willingham are joining me today to talk about the tools and technology that are being used today in rehabilitation. Deborah Backus is the Vice President of Research and Innovation at the Shepherd Center in Atlanta, Georgia. Dr. Backus is a researcher, physical therapist, and educator with more than 30 years of experience in the neurorehabilitation field. Brad Willingham is the Director of MS Research at the Shepherd Center. His work focuses on the development of innovative technologies and strategies to advance neurorehabilitation. Dr. Backus, Dr. Willingham, welcome. Thanks for being with us today.
Thank you for having us.
Yes, thank you.
Well, let's start with some basics. Dr. Backus, what is rehabilitation, and why is it important to start a rehabilitation program soon after getting diagnosed with MS?
Well, actually, John, you just beautifully defined rehabilitation. It is a set of strategies that help people return to function, and that could be mobility or arm and hand use, bowel and bladder, sexual function, helping people to return to function, to return to their health, and to live the fullest life possible. And it's a tool that we need because while there have been so many advances in disease-modifying therapies, drugs that help people with managing the progression of MS, and there have been advancements in symptom management, oftentimes symptoms remain. Progression sometimes still occurs, and there are things that rehabilitation can offer. So getting evaluated early after diagnosis and whenever things change with MS is really critical so that we can determine, do they need physical therapy, occupational therapy, speech therapy, or other tools or interventions to help them get back to function, stay as functional and as healthy as possible.
Dr. Backus, I think you just started to answer my very next question.
Oh.
I think that when people think about rehabilitation, physical therapy, and exercise, maybe the first things that come to mind, but the list really doesn't stop there. What other rehab therapies exist for people with progressive MS?
Oh, exactly. And you're right. I did start to answer those. So it is really critical that people consider where their problems lie. But for instance, if somebody has problems with their hands, they've lost dexterity, or they've lost function and ability to lift their arms or to control their arms in space, it may make it hard to go, they might be able to walk across the room, but they can't open the refrigerator to grab themselves a Coke or a soda or something. So occupational therapy can help them restore the function in their arms and hands, maintain that function. Speech and language pathology can help not only with, sometimes there are speech problems with actually forming the words and clearly speaking. So that's obvious. A speech therapist could help with that. But speech therapists can also help with some of the cognitive deficits that occur, such as slowness in processing, being able to get through those thoughts at the pace that people would like, memory, strategies for visual spatial processing, all of that. The speech language pathologists can also help with that. And then there are services around, people don't often think about this. Physical therapy isn't just about walking. Physical therapy is about being able to move around in bed, being able to get safely from a scooter or to another surface, or a wheelchair to another surface. But it also includes things related to bowel and bladder function, how to be able to, function for elimination and to control the bladder. There are tools that people can use for those too. So, the symptoms of MS are so heterogeneous and variable, but there are therapies that can address a lot of them.
Dr. Willingham, we heard from Catherine, who lives with progressive MS and uses a wheelchair for mobility. And Catherine wants to know how she can independently exercise while in her chair. And she's wondering whether there are any tools available that might help her.
Yes, Catherine, this is a great question because it highlights that exercise can be safe and effective for folks with a wide range of ability levels. And there are many ways you can engage in health promoting activities while remaining in a wheelchair. So in terms of resistance exercises, those exercises that improve muscle size and muscle strength, you can use free weights or tools such as resistance bands to get some resistance to your muscles. You can even use some soup cans or water bottles laying around the house to curl those weights up or press them overhead. Overhead may be a little more challenging. In core stability, you may need a chest strap or a fitness partner to help stabilize. But there are great exercises that scientific research has shown can result in improvements in strength and range of motion. With aerobic activities, so those exercises, they get your heart rate up, get your breathing rate up. They can improve your heart health and your lung health and metabolic health. There's exercises you can do while remaining seated in a wheelchair as well. So using tools such as a arm cycle. So this is a cycle that you use your arms to pedal. You can apply resistance, get your heart rate up, breathing rate up, and also just do some spinning of the arms, shadow boxing. There's actually some scientific research showing that seated dance can have a profound impact on physical and mental health. So it's all about, finding the exercises that are safe, but also enjoyable for you. And if the things I mentioned may be a little bit too much too soon, start with some posture exercises. And so bringing the shoulder blades back, engaging the core, sitting up straight, holding that 30, 60 seconds at a time, incorporate some controlled breathing, slow, deep breaths, engaging those core muscles. So there's many ways we can adapt exercise that all have benefits for physical and mental health.
I wonder, could I add something, John?
Of
Because all those
course.
are awesome, fabulous. And I would love to share, some of our work in functional electrical stim interventions, showing that people can cycle with electrical stimulation on their legs, which is also been shown to be beneficial not only for people with relapsing remitting MS, but also progressive MS to reduce their symptoms. So we've done a lot of work in that area, and we've been really pleased with the outcomes.
This is a perfect segue into the next topic I'd like to get into. Like so many areas of our lives, advancements in technology are expanding the rehabilitation landscape. Adaptive devices like voice-activated home systems and even robotic arms can help people with progressive MS attain better health and wellness while maintaining their independence. So let's talk about some of the tools that are available today. Dr. Backus, I want to circle back to FES in just a moment. First, we have a question from Charlie, who says he experiences foot drop, which causes him to often trip and sometimes fall. Charlie's physical therapist recommended using a brace called an ankle foot orthosis, also known as an AFO. Can you tell us about AFOs and explain their benefits?
Yes, absolutely. So as you said, they are braces. They usually go around the foot and fit into a shoe. And then you can come up the calf. and they help, based on how they're set up, control the knee and the ankle. So they can be very rigid and hard to help prevent the foot from moving at all so it doesn't drop down. The dropping down causes people to trip. So this prevents it from doing that. But there can also be some flexibility depending on how strong somebody is. And if they have a weak knee, it can help control the buckling of the knee or what's called hyperextension, where the knee snaps back. So it can be a very useful tool for some people.
Well, Dr. Backus, we just heard from Samantha, who also experiences foot drop and weakness in her thighs. She said an AFO device didn't work for her. So instead, she's trying something you mentioned a moment ago, functional electrical stimulation, or FES. Can you explain a bit more about how FES works and how it can help people with mobility challenges?
Absolutely. So functional electrical stim is providing stimulation to activate the muscles or make the muscles contract. And notably, most of the interventions that we use, and especially for foot drop, are surface electrodes. So they're little pads that go over the muscles. They can go over the muscles in the lower leg, or they can go on the thigh muscles, and actually even on muscles in their buttocks or their trunk, depending on the intervention. But for something to replace an AFO, when people have foot drop or they have weak knees, they can get stimulation devices, and there are a couple of companies that make them, that provide stimulation to the thigh muscles or the calf muscles while somebody is walking, and they are set up so that they're timed to the right phase of walking, so that when you need to put weight on your leg to come over your leg, it stimulates the thigh muscles so that the knee doesn't give out. And as you go to lift up your foot, it can stimulate the foot muscles so that you can lift up your foot safely. So oftentimes that's a very useful tool, and it can be used in two ways. One, it can be used like the brace. Like if somebody is very, very, very weak and they're not improving in strength, they can continue to use this device just like they would a brace. But it's also been shown in some people that when they have used it for a while, their muscles do start to get stronger, and so they might be able to stop using that device. So FES can be used to replace muscle function, or it can also be used to help strengthen muscle function. So we use it in both ways.
Dr. Willingham, Judy tells us that she's lived with primary progressive MS for 10 years. She gets fatigued easily when lifting weights. So now Judy does low load resistance training with blood flow restriction, or BFR. What is blood flow restriction training, and what are the benefits and risks associated with BFR for people with MS?
Yes, blood flow restriction training, it's a very interesting topic. So blood flow restriction training has actually been something that folks have been looking into for quite some time, about 50 years, starting in Tokyo, I believe. And initially it was explored as, okay, can blood flow restriction enhance the benefits of exercise, right? So in general, when we exercise, we're creating a signal to our body, and that signal is what results in all the wonderful adaptations: increase in muscle strength, increase in metabolic health, cardiovascular health. And so the idea with blood flow restriction is, by restricting blood flow to the muscles during exercise, can we enhance that signal? And therefore, can we enhance the benefits? And so this may be very interesting to explore in folks who experience muscle weakness or fatigue, who may not be able to exercise at very high intensities or for prolonged periods of time. So the question becomes, okay, so if we use blood flow restriction, can we enhance the benefits or the signal that comes from lower intensity exercises or shorter duration exercises? And there's definitely been some research exploring the benefits of blood flow restriction exercise in folks living with neurologic conditions. And specifically in the past half decade, there's been some work at the United States and Italy exploring the benefits of blood flow restriction exercise in folks living with MS. And so overall, the evidence suggests that blood flow restriction exercise is safe and well tolerated in folks living with MS. So when you are restricting the blood flow, you do cause a little bit more robust of a signal. So that may come with a little bit more sensitivity to those exercises. However, by and large, it seems to be well tolerated and safe. In terms of its effectiveness, there still needs to be a little bit more work done to determine whether blood flow restriction exercises is in fact more beneficial than conventional exercise or exercise without restricting blood flow. So a little bit more work is needed to determine its effectiveness. However, I'm excited to see where this field of research goes, because anytime a treatment can be, done independently with low risk, non-invasive, it has a lot of promise to provide an accessible and affordable solution. So looking forward to see where this goes.
Dr. Backus.
Yes.
Complex rehabilitation technology is a category of specialized equipment that's medically necessary and individually configured. This includes power wheelchairs and adaptive seating systems. What other types of equipment fall into this category? And maybe you can talk about why these kinds of devices are so important.
Well, if we stick with the mobility devices, there's also scooters, which are very useful for people that have the kind of symptoms and mobility challenges that people with MS have. There are assistive devices besides the AFOs, canes and walkers and such that can be useful. Walkers that actually have seats in them, so that if somebody gets fatigued, they can turn around and sit down in their walker, and then they can continue to walk. There are standing devices, standing wheelchair devices, and standing frames that are less commonly used, but can be used for people that have extreme paralysis. And there is an increasing research around and prescription of robotic devices for ambulation, for walking, that could be useful as well. In order to get those devices, somebody needs to be carefully evaluated. So depending on what they're looking for, I would recommend an assessment by a specialist physical or occupational therapist who knows about mobility devices. We here at Shepherd, we have a seating clinic where they get comprehensively evaluated to see if a new tool would be appropriate for them. That gives them a full assessment of what their abilities are and where their limitations are and what would be best. Should they go from a manual chair to a power chair? For some people, the power chair just allows them to do so much more in their daily life, so they're not quite so tired. But other people prefer to stay in a manual wheelchair because it's lightweight and easier to move around. But the specialist can help with that.
Dr. Backus, we heard from Angel, who says that he's having trouble transferring in and out of his manual wheelchair. And Angel's thinking about getting a power wheelchair and specialized seating, and he wants to know what's involved in upgrading from a manual chair to complex rehab technology, and which specialists should be involved in that process.
Yeah, so mentioned a little bit about that. In order to get upgraded or changed, a prescription is necessary. For insurance to cover a new wheelchair, a prescription is necessary, and a physical or occupational therapist with seating experience, what's called seating experience, who knows the different wheelchairs and knows how to do the assessment would be best. But it doesn't necessarily have to be a seating clinic like we have, but somebody who can look at the abilities, look at where they need help, look at the size, look at the environment they're going to be in and the activities that they're going to want to do would be very helpful. And sometimes it's a challenge if somebody needs to change their wheelchair very soon after they got one. That can be a challenge with insurance. So involving the physician in that discussion for the prescription is very meaningful, so that they can help support the medical necessity or the necessity for a device like that.
Dr. Backus, for people with progressive MS who have lost the use of their arms or hands, a robotic arm can be life-changing. Can you tell us a little bit about what a robotic arm can do?
So robotic arms can most effectively help with control at the elbow and the wrist and hand. So they can help with hand opening and hand closing. There's upper extremity arm and hand use in people with MS is one of the least studied areas. So we can draw on literature from people with similar types of impairments. So weakness, spasticity, loss of dexterity and sensation. like spinal cord injury. And what, like you said, if they can learn to use these tools, oftentimes it can make the difference in how, whether or not they can feed themselves, dress themselves, manage things in their everyday environment. So it can be a very useful tool.
Dr. Backus, Kyle tells us that he knows a robotic arm is very expensive, and some of the other tools we've discussed are quite costly. He wants to know whether insurance covers these devices or are financial assistance programs available.
Yes, so it's very difficult to get these devices covered by insurance. And so there are oftentimes state programs. The National MS Society has some financial programs for tools. There is limited literature and limited research. So because that evidence base is not that strong yet, it's still a challenge.
You know, when you think about progressive MS, people often think of mobility, but it can also make it difficult to move around or manipulate small tech devices that require fine motor control, like a smartphone, for instance. Now, the good news is that voice-activated systems can make those sorts of things more accessible for individuals who face these challenges. Dr. Willingham, what are some common voice-activated systems people can use? And I'm hoping you can share some examples of how this technology can help someone who's living with MS.
Absolutely. Voice activated systems can be very helpful in promoting accessibility. As you just referenced, most of today's, mobile phones, devices, tablets, even desktop computers, out of the box, they come with voice activated systems. And so these voice activated systems can be very helpful with a wide range of tasks for, your digital devices, such as setting reminders or asking questions about the weather or, simple questions for the internet. You can also use voice-activated systems to compose text messages, emails, make phone calls, and with desktop computers, many of the voice-activated systems can allow you to actually operate the computer, open up specific programs, even compose a document with voice dictation. So many ways these systems can help you in the digital domain. What's really interesting is what we've seen more recently is the transition to voice-activated systems into the physical domain. So we now have systems like Amazon Echo or Google Home or Apple HomePod, and these systems now bring voice activation to some of the hardware and appliances throughout your home. So through these systems, we can now have voice activation of a light for a light switch or a thermostat or a door lock. So you can see how if you can, manipulate lights, locks, and thermostats by voice activation, this may overcome barriers associated with small buttons, switches, or even areas of your own home that may not be too accessible. So in many ways across both the digital and the physical environments that these voice activation systems can improve accessibility.
So if someone is interested in setting up a voice-activated system in their home, where do they start?
I mean, I would suggest is starting with the need, thinking through, where are your barriers, right? Where are your trouble points? Is it, setting reminders? Is it writing text messages? Or is it more physical tasks such as light switch tasks? And once you identify those problem spots, then work backwards and find a solution from there. What is the technology that could potentially help? And so once you identify some technologies that may help overcome those barriers, start low, go slow. Same with exercise. Maybe test out some of these applications on your smartphone or your personal tablet, then maybe go to a smart speaker in your home, get used to the voice commands, the type of voice commands the system needs, whether you like it, make sure it's compatible with your other devices, and then slowly start adding things. Add some smart lights, add some smart locks. Then over time, you'll become more comfortable and you'll be able to even schedule things with the voice activation. Turn on my lights at this time, turn on my thermostat at this time. And so the accessibility will just grow from there.
Dr. Willingham, we heard from Cheryl, who says she keeps hearing all about AI and how it's changing our world. She wants to know whether AI is being used in rehab tools, and if it is, how can this technology help her and others who are living with MS?
Yes, great. Another great question. All the buzz around AI and growing up not in data science, I always thought AI would come to us in the form of, robots that look like us and talk like us. And that very well may be, but it's important to know that AI is actually being used right now to advance rehabilitative care and primary care as well. So one of the things AI does best is its ability to ingest large amounts of information and extract meaning and identify patterns in that information. And so why is this important for today's healthcare is we now have all of these different technologies, rehabilitation technologies, some we talked about today, and various medical devices. So you have your wearable sensors, your telehealth platforms, your electronic medical records. We have all these wonderful technologies that allow us to understand the needs and progress of patients in ways never thought possible. However, it's a little bit of a challenge on the other side is dealing with all of this data and making sense of all this data. And so something our work here at Shepherd and others are working on is, can we use AI to ingest, large amounts of, varying types of health information and make sense of it and identify patterns in there? And what we're seeing is that indeed it can, and AI is helping us to use health information to determine which treatments may be best for which folks, how may we best use our time, get the most out of our time in terms of rehabilitation, but also early detection. So detect, issues early on before they escalate to more severe problems and take early action. And so these are some of the ways AI is being used right now and making a difference in today's care.
Dr. Willingham, Serena contacted us with 2 questions. She said, we haven't touched much on apps yet. She's wondering if there are any mindfulness or meditation apps that can help manage stress, anxiety, or other mental health aspects that are related to MS. And Serena also wants to know how digital health apps can complement her overall rehabilitation plan.
Yeah, absolutely. So, there are several mindfulness and meditation apps on the market, and some of the most popular, I think, are Headspace and Calm. And these apps and others, they provide extensive libraries of different guided, unguided meditation content, stress management tools, and as well as just some educational resources about self-management and mental health. And so these apps are great because they package all of this content into a very user-friendly app that fits on your smartphone in your pocket. You can carry around, and you can integrate these practices into your day-to-day life simply by just taking a moment, opening the app, and practicing some meditation or mindfulness. And in terms of integrating with your standard rehabilitation practice, they actually create a little bit of synergy with your rehabilitation practice, because based on the scientific research, practicing mindfulness and meditation may improve sleep, it may improve cognitive function, it may facilitate with pain management. And so you can imagine if you're getting better sleep or you're managing your pain, this may also allow you to engage at a deeper level in other aspects of your rehabilitative care, such as physical therapy or occupational therapy.
Dr. Willingham, we've talked about a lot of different tools today. With so many gadgets and apps available, how does someone know what tools are right for them?
Yes, and this partially gets me to one of the overarching messages for today is start with the need. So go through your day today, go through your specific exercise program, identify what are those barriers, what are those points of inaccessibility, and then work backwards from there to find a technology solution that works for you. There's a lot out there, as you mentioned, so it's easy to get caught up in what is the latest and greatest, or what is the most sophisticated or high tech. And sometimes you may not even need something that high tech or that sophisticated to overcome a barrier. So starting with the need, identifying potential solutions, and then thinking about, what works with the technology you're already using. Compatibility is certainly an issue. And then also asking folks, a lot of times we are focused on outcomes, clinical outcomes. And there may be something that your provider or someone with a shared lived experience is using. And you know how it is with technology. You start using something, next thing you know, it's second nature. You don't even realize you're using it. And so asking folks with shared experiences or expertise, Are there technology solutions for this or for this? It may, bring that to the front of their mind, and they may be able to, oh yeah, I use this all the time. It's great. So yeah, just using that crowdsourcing approach as well.
Well, I have a question for both of you, or I should say each of you. Innovation is at the core of what you both do every day. Can you tell us what you're currently working on and maybe give us a preview of anything that we might see soon that people with MS should be looking forward to?
You want me to go first? You go first. If you want to.
It's up to you.
Well, I'll just give so one of the things that we started early on is to really focus on the people with MS who are underserved, and that includes people with progressive MS. So we have a heavy focus on finding and developing approaches to help people with progressive MS get back to function and to stay healthy. So we do a lot of work in functional electrical STEM. So with bikes, as we talked about, but also other ways of using functional electrical STEM combined with robotics and different ways of using the tools to help people with their everyday function. So that's a big focus, one of our big areas of focus. And the other is developing tools that will reach more people. So Shepherd Center, we are a center of excellence for MS care. And there are a few across the country, but they don't reach all of the people. So we focus on finding ways, tools that we can help develop, and then we can evaluate the effectiveness, but that we can push out and make available to more people around the world. And so we're working with a platform that provides some of the things we talked about today, exercise interventions, deliberately developed, specifically developed for people with MS, whether it's in the chair or standing, mindfulness approaches, meditation, cognitive training exercises, and we're evaluating the uptake of those tools and the barriers to those tools for people not only here at Shepherd, but in very rural communities, in other states and other countries, so that we can hopefully help more people. And then Brad's got a whole slew of things.
A lot of which are related. And so I guess we could just highlight some of the active projects right now. And so one of the key problems we've been working on is that the advancement for care for people living with MS, particularly progressive MS, is limited by the lack of tools that allow us to measure changes in physical function and health over time in the real world with high acuities. So we have many great tools that we can use currently in the clinic, to measure clinical disability, function, health, mental health. But most of these can only be used, on site in the clinic under supervision. And so we're limited in our ability to capture important changes that may occur between visits. And it could take several months to detect changes in a disease course or progression of disability. So this, slows down, early intervention. It slows down our ability to respond, but it also slows down the progress of clinical research and the length of time it takes to explore new treatment strategies. And so as a solution, we're working with many great industry partners to develop and test some novel digital health solutions that are allowing us to expand clinical evaluation into the home, into the community, and drive scientific discovery as well. And so particularly, we're working with some novel wearable sensors and some new intelligent data systems we're developing. And so using these new wearable sensors, we can create systems that can continuously evaluate a patient's needs, abilities, their progress in real time on a day-to-day basis, with the ultimate goal of allowing us to detect changes in physical function and health, in real time, immediately. This will allow us to identify, when a symptom begins to worsen, allows us to take action earlier, and treat these symptoms before they cause more severe problems. So always, hopefully also allow us to speed up research studies, allow research studies to be performed quicker in smaller groups of people, which may ultimately allow us to test new treatments faster, and so accelerate scientific discovery in that way.
Well, I think you both have opened a lot of eyes today about the possibilities that exist thanks to some of the latest rehabilitation tools that are available for people who are living with progressive MS. What would you each say is the single top takeaway that you'd like our viewers to remember? And Dr. Willingham, why don't we start with you?
Yeah, whether it's exercise, rehabilitation, or technology, something I always like to share with is start low, go slow, and something is better than nothing. And so there's a lot there. So when you look at the scientific research about exercise and rehab, or if you're looking at all of today's latest and greatest technologies, it's easy to get overwhelmed. We have access to so much information today. It's a little overwhelming. And so start with a specific need, a specific barrier that has an immediate impact on your life. And again, work backwards from there. Find a solution. Start low, with exercise. Find something you enjoy that you feel comfortable with. Start at a cadence that's okay for you, right? You can break these exercise bouts up over time. You don't want to go all in too much too quick. And the same thing with technology. Piece these solutions together piece by piece. Start using voice activation on your home. Work up to, where you're scheduling voice activated smart home systems. And so that's essentially my take home for all of this. And yeah, thank you again for having us. It's been a pleasure.
Dr. Backus, how about you? Your single top takeaway?
So my single top takeaway is seek rehab early, and don't be afraid to ask your neurologist to refer you to rehabilitation professionals. All of the strategies that Brad suggested are so critical and great, but still at times it can be very overwhelming. So there are specialists, there are physical therapists, occupational therapists, speech therapists who can help you. And neurologists, of course, they provide the best medical care, but they shouldn't wait until somebody falls to refer them to rehab. You need to get them evaluated, find out what the tools are used. Somebody who's an exerciser shouldn't have to stop exercising. They just need to find out how. So my takeaway is seek out that advice from the professionals when you have those questions. Don't wait. Don't be afraid. Start early and do it often. Take care of yourself. So also thank you for having
I want
us.
to thank everyone who submitted some great questions today. And I want to thank Doctors Backus and Willingham for being with us. Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Doctors Backus and Willingham for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's program is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Deborah Backus and Dr. Brad Willingham and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.